Hello, I am Dr. Farshad Amini Behbahani and this is short course of Iranian traditional medicine. In this section, we evaluate the organs as one of the tools of the nature. Before beginning of this section, I should mention that there is more explanation in description part of the videos. You can check them by clicking on description button under the video and see them for more explanation. Also, this part has description. Please check them and read them for more information. Organs mostly classified under the anatomy. The anatomy of the modern medicine and Iranian traditional medicine has not so much difference. Actually, just some nomination and classification because of different viewpoints. For example, in Iranian traditional medicine, we consider the liver as the origin of all veins. So, every vessel that attach to right side of the heart is called vein. And on the other hand, every vessel that attached to the left side of the heart is called artery. So, the pulmonary artery in modern medicine translate to the arterial vein in Iranian traditional medicine because it has arterial structure, but it attached to the right side of the heart. Contrary, the pulmonary vein is called venous artery in the Iranian traditional medicine because it has venal structure but attached on the left side of the heart. Another difference in nomination is in cranial nerves. In Iranian traditional medicine, we just have 7 cranial nerves because the nomination of cranial nerves is based on their outlets from the skull, not their origin on the brain. So, olfactory nerve in modern medicine, in traditional Iranian medicine, is just cribriform palate. Another difference that we can see in other traditional medicines schools also is spleen. In traditional medicines, Chinese, Iyorveda or Iranian traditional medicine, when we talk about a spleen, actually we talk about both pancreas and spleen in modern medicine. In Iranian traditional medicine, when we talk about uterus, we are talking about vagina and uterus both together. Also, there is another classification based on the viewpoint of temperament. Considering the skin, especially the skin of palm, and more especially the skin of tip of the index on the palmar side, as a balance reference, other organs can be classified under 4 groups. Warm organs like heart, blood, liver, lungs, and kidneys. You can see more description by detail in the description part. And cold organs includes mucus, includes fat tissues, brain, spinal cord, tendon, ligaments, and wet organs include mucus. Again, some organs are in two groups. And for example, fat tissues and liver, blood, lung are in the wet organs group. And dry organs include hair, bones, ligament, tendon, cartilage are in the dry groups. Understanding the temperament of organs is important because in most situations you can find the distemperament of organs or intrinsic temperament of the organs by pulping of tip of the index finger of patient or the palmar side only by a handshaking. You can guess the whole temperament of the body of person. Of course, you can have a comparison to the skin temperament of the patient and the aim organ and judge the mistemperament or distemperament of organ. Also, when one organ be warmer or colder or drier, other organs try to compensate its distemperament. So you can have a better exam by understanding the temperament of organ. Also, every organ, like everybody, like every person in the community, has its territory of temperament. By exiting of this territory, the organs will be ill. Another classification in Iranian traditional medicine that is different from the modern medicine is classification based of importance of organs. For continuing the life and reproduction, some organs are very essential. Includes the brain, the liver, and the heart for continuation of life, and testicle and ovaries for continuation of reproduction. We call this important organ the chief organs. There are some other organs that their temperament affect on the whole body, or they are so delicate and susceptible to pain that if become ill can affect on other organs, and also they are important for serving the chief organs. We call these organs noble organs, including, for example, the eyes, lungs, stomach, and uterus. If you have illness in stomach or uterus, this illness spread to all of the body. You cannot live without brain. You cannot live without liver or without heart. Immediately, the person will die if one of these organs mostly damaged or bring out. But maybe by a damaged kidney, the person can survive for several days. Okay, why is important we classified the noble organs and chief organs and consider low rank organs in the other part of the body? In treatment, the healer should consider every time and periodically during the checking patient the strength and ability of protecting these noble and chief organs from themselves. The healer should not push the harmful material of disease toward the chief or noble organs. And if the chief or noble organs become ill, the healer tries to expel the extra waste material from them. And if expelling from the body is not impossible for some reasons, the healer should push them and lead this extra harmful material toward the low rank organs like joint, like colon, like hemorrhoid. Anus is a low rank organ, or skin of patient. For example, by cupping, you lead the extra waste materials, harmful or pathogenic material, toward the skin. Some healers can predict the kind of material by color of skin under the cupping. During the treatment, periodically the strength of organs of chief and noble organs should be checked. Every inflammation, every pain in this organ is very important. The treatment, if there is pain or inflammation in these organs, the treatment of other low rank organs should stop, and expelling and evacuation of these organs should be considered, especially in humoral distemperament of the low rank organs. This is important. You cannot treat, for example, inflammation of joints when you have a weak heart. You first should strengthen the heart, protect the heart by some tonic medicine, and then going toward the, for example, the joint.